Hello, GoFundMe Nation. My name is Matt Tanner. I'm an American. I live in Georgia, and I recognize that we are undeniably the greatest nation this earth has ever seen. I'm blessed, as we all are here in America, to be born here, whether we immigrated or our parents immigrated over the years. We truly have the greatest country on earth. And there's a lot of talk nowadays that we want to equal the playing field. And mostly that talk is focused on America. What most people don't understand is that even the poorest Americans are rich when you compare them to folks that are living in South America, Africa, parts of Eastern Europe, and most parts of Asia. And the disparage between what we see in America as the things that we need and the things that we want compared to what some of these poorer countries see as needs and wants are vastly different. Look at Maslow's hierarchy of needs, and the basic needs of shelter and food and clothing. More than 95% of Americans have that. Unfortunately, in continents like Africa and some of the poorer countries, it's almost flipped the other way around. Almost 90% of folks that are living in Sub-Saharan Africa that don't live in big cities do not have enough food each day. They may go one or two meals. Sometimes the parents have to sacrifice their meal so that their children can eat. And it's just a sad situation all around. It's been something that's been on my heart for a long time. I went on a mission trip to the country of Malawi more than a decade ago, and it changed my life. Never had I been put into that situation where I could see firsthand just how blessed that I was being an American. The coronavirus has impacted all nations, all tribes, all people in different ways. Here in America, there's a lot of news about the coronavirus and its impacts, the number of people that have died, and I don't want to get into any of that about the science or about the numbers, because at the end of the day, the death rate here in America is pretty low compared to some of the locations in some of these poorer regions of the world. In particular, Malawi, over the last few weeks, certainly the last month, the coronavirus has been just ravaging the country. Now, they don't have the medical facilities that we do here in the United States, so unfortunately, if you have some kind of underlying health issue, it doesn't look very, very good for you. Malnutrition is widespread throughout the country. In fact, almost half the country is under the age of 15. Just think about that. The death rate is extremely high in all of Africa, but really in Malawi, which is one of the top 10 poorest nations in the world, the death rate's extremely high. And the birth rate's extremely high as well. So you have this huge amount of younger individuals. Unfortunately, with the higher death rate comes a large number of orphans. And so you have these kids that are not able to work, not really able to get into school unless somebody comes alongside them and helps them get into school, that are just, kind of left to their own wits. And a lot of these small communities and villages in the more rural areas do have those people with really big hearts, although they don't have big wallets, they don't have big homes, but they take the children in anyway because you cannot just watch a child starve. So the pandemic has really been rough for the people of Malawi. I've got a few contacts that I've been in touch with. Not just the lack of medical supplies, medical facilities, but also food shortages that have been going on because of the supply chain disruptions, even in Malawi. And so food prices have skyrocketed. The economy, which wasn't strong to begin with, has just continued to hurt even more. If you look at the exchange rate between what a U.S. dollar goes for, it's just insane. It would blow your mind. So one of my contacts, his name is Moses, and he lives in a village with about 200 families. And there's only about 80 houses, so some of those families are living together, but about 200 families. There's about 80 orphans there. He's actually in the process of developing a nonprofit organization there in Malawi, which I think is great, with a focus on orphans and those that are at risk, that maybe only have one parent, or possibly widows that are at risk, because they don't have anybody that is helping to support them. Most of the economy in Malawi, especially rural Malawi, is farming and agriculture. So there's not not a lot of ways for them to be able to make money to purchase these supplies. And just like we had shortages here in America last year with things like toilet paper and things we would normally take for granted, the medical supplies, whether it be hand sanitizer or masks, are just really hard to get in Malawi. And if you do get them, it's really hard to pay for them. So I'm recording this video because I want to raise money to help Moses and his village. There's also some other people that I'm in contact with, but I've never done a GoFundMe, any type of crowd sourcing of any kind. Not really very millennial of me, I guess, but I have to start now. I have given as much as I can to him, and so I'm asking for your help. $5, $10, together through crowdsourcing. I mean, you can raise so much money so quickly. I've got pictures that I'm going to be posting. I'm also going to be writing up a little more information about the data there in his village, as far as those households, the orphans, the number of school-age children, and things like that. So if you're able to, even if you've been negatively impacted by the coronavirus, if you've got $5, the people in Africa, the people in Malawi could really use your help. Again, my name's Matt Tanner, and I really appreciate your help in this.